We spoke with leaders in cardiology, nephrology, and genetics to see how far we've come in Fabry and what's left to do. What are the outstanding needs we still have in Fabry disease?
Fabry disease is a tough disease, and so daily things that they would experience. And number one is pain, and unfortunately, it's interesting because when you ask a patient with Fabry disease to fill out a patient-reported outcome about pain, their baseline is much higher than someone without Fabry disease.
There's not a lot of focus on how much this impacts the person's quality of life. For them to get surveillance, 1 to 4 times a year, and also receive a treatment every 2 weeks, whether it be in a clinic or in their home, it has a major impact on a person's job. Missing work and missing time with family, or having to coordinate their family life around this new therapy that they have to get every 2 weeks.
Chronic fatigue is very common in people with Fabry disease. But a lot of them, when I ask about that, they're like, well, I don't know how much of this is abnormal. I mean, lots of people like to take naps. And I had one patient that, I asked him, well, how many naps do you take? And he'd say, I have to take a nap every day. And I said, well, how long is that? And it turned out that he was sleeping about 18 hours a day. And it's like, that is not normal.
I think you have to be agnostic, and you just have to approach patients that anything is possible. We are about to report some data that perhaps up to 15 or 20% or maybe more of patients with Fabry have lymphedema.
These are lots of little things, so it's not just kidney, brain, heart. This is a multi-systemic disease, and if we just have to approach it that way, where you see everything.
What gives you hope for the future of Fabry?
I think that we're getting smarter in our therapy. I think that we're understanding not just the disease as a whole, but other ways to tackle it.
I think that people are a little more in tune about what they should be looking for and about what the possibilities may be. And that really informs what kind of surveillance strategy you pursue.
When I first started, we couldn't find men with classical Fabry disease who were in their late 50s. And now I have men with classical Fabry disease, a couple of them who are in their 70s. That gives me hope too.